What is health? Definition of health. Health is defined internationally, a definition adopted by the World Health Organization in 1948, although there is no clear agreement on it. According to this definition, health is a state of complete well-being, not only that a person is not sick or disabled, but also spiritually and socially. This definition is internationally recognized, but in some ways debated. Based on this definition, the definition of disease, or dignity, is a state of deterioration of health, which refers to disorders or loss of function that change the normal functioning of a person in biological, psychological and social aspects. As a biopsychosocial being, a person can have health and disease in terms of all three components. The disorder that occurs in any of these aspects can negatively affect the other two aspects. Man is a biopsychosocial creature. Biological, psychological and social processes have positive or negative effects on each other. Any disorder is a cause of illness. In defining health, the World Health Organization describes disability, physical, spiritual and social well-being as follows. Disability is the fact that tissues and organs are partially or completely dysfunctional as a result of events such as congenital, disease and accident. Disability is physically challenging and disrupts the person's daily life. Bodily well-being is a condition in which there is no physical or biological disorder in the organism. In the case of bodily well-being, the body can perform all its biological, biochemical and physical functions. In order for biological functions to be maintained in a healthy way, the organism needs to adapt evolutionarily to the conditions in which it lives. For example, people cannot live in extremely hot or cold environments if they do not take precautions. But only biological health is not enough to say that a person is completely healthy. A state of psychological and social well-being is that a person can adapt to their environment, society, and live at peace with themselves. It is a situation where there are no failures in a person's relationship with society. Lifestyle, economic conditions, professional identity, social status, hierarchy, cultural factors, social events positively or negatively affect a person's psychosocial processes. This, in turn, directly determines the health of the person. In the same way, these psychosocial processes are not independent of the person's genetic characteristics. When all these states of well-being are present together, we can say that the person is completely healthy. In the case of complete goodness, the body is in a state of balance in these aspects. A disorder that occurs in any of the biological, psychological or social aspects will also lead to disruptions and imbalance in other aspects of the person.